Women have a variety of reasons for wanting to potentially get breast implants, better symmetry, different size, different shape. Whatever your reason, you have to decide what kind of implant you want. Our good friend Dr. Kordestani is with us today to go through the differences between saline and silicone implants. There are some pretty major differences, and I guess I didn't really even know do you have a preference? Is there a preferred?
You know, first of all, it's good to see you as always.
Oh, as always, yes.
So, you know, it's kind of a show and tell. I brought some implants.
Okay.
We can kind of get a gauge of what's going on. When you ask that question about preferences, of course, every surgeon in time develops preferences. For myself, I have a silicone preference.
Okay.
I like it better because of the fact that it seems and it feels more natural.
Okay.
And the idea of surgery is to kind of correct something after kids, like in a mommy makeover, if in fact you've been bigger, smaller, etc. You want to go back to feel something natural.
Okay.
As you can kind of tell, this is the silicone and this is the saline. Saline, some people like it because they think it's more safe, but it just basically, it's water inserted into a bag as opposed to silicone. So it tends to kind of be different feels. Do you
now
want to try?
The saline can change. You can alter it, right? Like maybe you want to put more into it at some point or something like that, right?
Just like as we've kind of got this here, we can actually insert it. Usually comes deflated.
Okay.
We put it in, and then basically we adjust the fill, as you say, how big it is, on the table. So you can put it a little bit bigger, see what it fits to the patient. We tend to use something similar for the silicone, but then the silicone comes in a prescribed size, a volume. And then when this goes in, it's not altered.
Okay, let's talk about safety-wise, though. Okay. You mentioned safety. I think that's a lot of people, because back in the olden days when these first came out, there were some pretty bad horror stories. Things are much safer now. Okay,
that's actually a great point. So back in the late 70s, 80s, everybody was getting the silicones, and that's generation 1 silicone implants. And what happens, there was some concerns about ruptures, et cetera, and then finally the FDA actually put a moratorium on it, 1992. But then everyone's still under the impression that the moratorium still exists. Silicone is unfortunately bad. And what happened, the FDA went back and did extensive studies, and in 2006 came back conclusively and put it back on the market, saying there's no increased risk of any problems, there's no increased risk of cancer, there's no difference between the saline and the silicone. So since 2006, I'd say probably about 75 to 80% of the implants put into people are silicones.
Okay, let's talk about your recovery process and what the surgery and the procedure is exactly.
Well, the recovery process, a lot of times with us specifically, we tend to put in pain pumps, we tend to put in Exparel, I think Dr. Graves mentioned that for teeth. We tend to do that for breast implants as well. So patients' recovery times have been shortened a significant amount because they're not having that much pain. So the sooner that they don't have pain, they're slowly getting back into their usual routine and they bounce back. So it's actually done less and less.
And so and then if people are interested in this, they just come in for a consultation and you can really help them decide what's the right size, what the right style is, all of that business,
you know,
right?
It always is important to actually sit down, one, to see a surgeon that you like, and then basically a surgeon that you can trust. And kind of sit there and actually bring your expectations to the table. Don't come in and say, I want this, this, and this, but you have to be honest. If you really have an image of, I want to be this person in this picture, bring it. And sometimes it's realistic and sometimes it's not. But it's better to be open with your surgeon than not.
Don't you think, though, in recent times it's more trendy or on trend to be a more natural size and it's, you know, to not look like it's, you know, an implant?
Sure. I mean, I think at a certain point, certain places in the country went hyperbolic, basically went the biggest possible. And that's not the way we want to do it. What you want to do is something that looks natural, fits the person, fits the profile, shoulders, hips, etc., and looks like a natural complement as opposed to something that's out there.
Absolutely. Okay. Now then, as far as payment goes, you guys are doing a special promo, 10% off if you mention this segment?
Yeah, that's exactly it. What we're actually doing is doing a promotion like this, and also we have financing available across the board for all the surgeries. So the idea is some people come in and really want to get surgeries done, and they tend to be, you know, price restricted, and we're very good at AOMS to try to go through and work with people.
All right, very good. Dr. Kordestani, always good to talk to you.
Great
Thank you,
to
my
see
friend.
Okay.
Always good. All right, stick around. We're going to head to the kitchen with Rocky. We've got a jicama salad and jicama fries after